Mrs. Clark's skin is in great shape these days. She's happier and more comfortable that way. One skin problem that can really sneak up on our patients and residents is pressure ulcers. So Mrs. Clark's caregivers are always on guard for them. They know how awful they can be. The good news is that we can prevent many pressure ulcers before they ever get started. Regulatory agencies are stressing this important prevention effort, and we all have a role to play, including nurses, nursing assistants, family members, and even the patient or resident when appropriate. In this program, you will learn what causes pressure ulcers and some important steps you can take to help prevent them.
Pressure ulcer prevention. What caring people need to know.
This is a pressure ulcer. A pressure ulcer is a place on the skin where the skin, or the tissue underneath, has started there or in bed. Our body weight puts pressure on bony places, like the heel. Pressure cuts off the blood supply to the skin and to the muscle and tissue. Pressure ulcers can cost tens of thousands of...
It takes a few hours for a pressure ulcer to get started, often appearing as a stubborn red area. Quick discovery by nurses, nursing assistants, or family members, followed by good care, can reverse early damage. Unfortunately, tissue breakdown caused by pressure can get a lot worse. The skin may become blistered or broken, eventually becoming an open wound.
Every new admission to a hospital or nursing facility receives a head-to-toe skin inspection. Most certainly, a pressure ulcer would start right here at this pressure point under the bone.
The body has many pressure points. Tiny cells may start to die. But watch what happens if the patient changes position in time. Fresh blood
forces the blood out. When I let go, the blood can move much on his own. He is at high risk for pressure ulcers. So at least every 2 hours, his caregivers turn.
Wet skin is soft and swollen and weak. Even worse, urine, and especially stool, is called shear. Gravity pulls down on the skeleton and internal tissues, but friction holds the deep tissue injury caused by a brief period of shear may not show up on the skin surface until...
Pull of gravity causes internal shear and tissue damage. Keep the head of the bed. Limit time in the chair to 1 hour if he can't boost or see how that tugs the skin and scrapes the elbow.
Normal for skin to be red just after pressure is removed. But within about 30 minutes, healthy tissue will make sure the nurse in charge sees or knows about the trouble spot. To assess for a possible pressure ulcer, nurses look for persistent redness. Feel for skin that's warmer or cooler. The Blanching Test is a quick assessment for tissue damage. Press reddened skin for a moment, then may already have started. It's called non-blanchable erythema. It may not show up as well on individuals with a dark skin tone as it does on those with a light.
Ulcers begin on pressure points, where the bone is close to the skin's surface, like the heels. About a third of pressure tailbone or sacral area. The sacrum is the most common site. Is better. The 30-degree tilt position. See how the pillows spread out and keep the skin clean and dry. All this may feel like a duty, but it's really an act of caring.